everyone, this is Becky. She's going to be our model for us today. And the first application that we're going to talk about is a low back pain application. So for positioning, you want to make sure that we are stretching the low back or stretching the skin that we're going to be taping. So I'm going to have Becky here face the chair for me, and she's just going to lean forward so that we get a nice big stretch on this area here. So the area that we're looking to tape is right across the SI joints. So for most people, you're going to find two little dimples. So on her, we've got them right here and right here. Now, if you don't see dimples, you can go in and feel, and there's two kind of bump areas. Those are your SI joints. So you're going to take a piece of tape, and we're going to use what we call Band-Aid technique. So the first thing you're going to do is tear the tape down the middle, just like this, so we expose the back of the tape. And then being careful not to touch the adhesive, we're going to peel back the backer paper. So this is what it should look like. Now I want to note that you want to make sure that your thumbs are across the tape evenly so that as you stretch the tape out, you get a nice even stretch. Now I've seen people put their thumbs in the middle and stretch like this, but you'll notice you get some bending in the tape and the middle will stretch more than the outsides, and that can cause issues with skin irritation. So with the thumbs across the top of the tape and your fingers holding the backer paper to the sides, we're going to stretch the tape 80 to 90%. We're going to set it down right over the SI joints, and then I'll show you how to put the ends down. So her SI joints are here. I'm going to stretch 80 or 90, apply the tape, and then I just like to rub across the tape here. Now heat is what activates the adhesive, so a nice little rub across will help that to start sticking a little bit better. Now we've got two ends here, and those are what we call your anchor points. Now remember from an earlier video, the anchor points always go down with no stretch. This is really important for the tape to be able to stick, but also for the patient's safety, because if you stretch the ends, sometimes it'll cause skin irritation or blisters. Another thing to note is when the tape is made, it's made with a little bit of stretch already on the backer paper. So if you just take the backer paper off and you run the tape down like that, if I were to pull here and run it down, you're going to get a little bit of stretch on the skin. So the best way to do this is to pull the backer paper all the way off and then to press the end down. Same thing on this side. You're going to pull the backer paper all the way off, and then you gently rest the tape down. All right, from here you're going to grab a second piece. Same thing, you're going to tear it down the middle, just like that. Make sure your thumbs are going across the top, and you're going to pop the backer paper up and pull it back. So you get a nice good stretch in there. We're going to apply this right above the first tape, and then rub across to make sure it's adhered to the skin. Take the backer paper off one end, lay it down, take the backer paper off the other end, and lay it down that way. Now Becky has a pretty small back, so I'm just going to use two pieces of tape for her. But if you have a client or you're taping yourself and you feel like you need a few extra pieces, you can put another piece above here or below, just depending on where you feel like you need extra support. And then when you're done, have the patient come up